Public Health Officer for Manitoba. Today we're announcing 2 additional deaths due to COVID-19, both from the Winnipeg Health region. I want to extend my condolences to all the families, friends, and caregivers of the individuals announced today. The current 5-day COVID-19 test positivity rate is 6.5% provincially and 6.8% in Winnipeg. As of 9:30 a.m. today, 181 new cases of the virus have been identified, and the total number of lab-confirmed cases in Manitoba is 37,069. As you can see, our case numbers are high again today, almost at the 200 mark, and as you know, we hit well over 200 cases yesterday. We have been here before. We are seeing case counts and trends that look very much like the situation in early October, though there are some differences between today's situation and the situation in the fall. Now, variants of concern case numbers are rising quickly. We're seeing case numbers rise faster in younger people. While fewer people are going into hospital, more of them are requiring ICU care. We have more tools at our disposal than we did in the fall, like the vaccine, but we're also seeing case numbers move very fast. Even with our vaccination program, we could see cases increase very quickly, leading to another lockdown. Manitoba, it's up to us. Without people significantly changing their behavior, we will have to consider another lockdown. But if we buckle down once more, we can avoid the impacts of a lockdown. Public health orders detail the maximum level of restrictions that are required. We would encourage individuals, Manitobans, and organizations to take as many precautions as possible, even beyond the orders, to protect from rising case counts. Addressing the third wave of COVID-19 requires all of us to do our part, both in adhering to the orders, but also taking any additional steps we can to reduce contacts and the potential spread of transmission. Reduce your close contacts. Stay home as much as possible. If you have symptoms, get tested. This applies to everyone. Don't think that just because you're young and healthy, you aren't affected. Do your part to help us save summer. Thank you, and now I'll turn it over to Dr. Reimer.
Thank you. Good afternoon, everyone. I am Dr. Joss Reimer, the medical lead for the Vaccine Implementation Task Force. Earlier this week, we announced that we would provide more details on our plan to expand eligibility to specific neighborhoods where the risk of COVID-19 is disproportionately high. Today, I can confirm the first 3 priority neighborhoods have been identified. So beginning today, anyone who is 18 and over and lives in the Downtown East, Inkster East, and Point Douglas South neighborhoods in Winnipeg is now eligible to make an appointment for their COVID-19 vaccine. In addition, people who work in specific jobs in those 3 communities are also eligible. I did announce those worker categories earlier this week, but want to reiterate that it includes people who work in schools, who work in other childcare facilities, as well as people who work in food processing facilities, grocery stores, convenience stores, retail gas stations, and anywhere that serves food directly to the public, which includes restaurants and food banks. Our analysis has shown that these communities are particularly hard hit, or at high risk for transmission. Our risk analysis included looking at COVID-19 rates starting October 1st onward, population density, the percentage of the populations that are racialized in these communities, income levels, and access to suitable housing in these areas. Making the vaccine available to everyone who's over 18 in these areas is expected to help control the spread of the virus. It should reduce serious illness and help protect our healthcare system as well from being overwhelmed. So I want to strongly encourage everyone who is eligible in these priority communities to make their appointment as soon as they can. So these folks can attend our super sites in Winnipeg, Brandon, Morden, Thompson, and Selkirk, or at a pop-up clinic if that's more convenient. A new option that people can book now if they call the call center is the super site that will be opening on Leela Avenue in Winnipeg on May the 7th. Appointments can also be made at the urban Indigenous vaccine clinics. that will be held at the Aboriginal Health and Wellness Centre on Higgins and Mamawi Wichi Itata Centre on McGregor. Both of these will be open next week. The third wave of the pandemic is here in Manitoba, and getting the vaccine is key to reducing the effects of the virus. We have been in this situation before where we've seen rising numbers of COVID-19, but this time we have the vaccine. Today's expansion into the priority communities of Downtown East, Inkster East, and Point Douglas South is in addition to all of the other people who are already eligible. So this includes our frontline police officers and firefighters, employees in the healthcare sector or congregate living facilities, as well as all Manitobans who are 50 and over or First Nations people age 30 and over. Manitobans age 40 and over are also eligible for vaccination at a medical clinic or pharmacy. We are regularly adjusting our eligibility criteria, and we regularly adjust our projections on how quickly we can immunize all eligible people in our province. I know Johannu shared some updated projections earlier this week, and all of these numbers continue to hinge on the supply that is available to Manitoba. So please book your appointment as soon as you are eligible and encourage your friends and neighbors, your co-workers who are eligible to do so as well. If you know someone, a family member or a friend who might need help booking their appointment, please help connect them with this life-saving intervention. You can do that with their permission, with their name, a health card number if they have one, and a few other details. Regarding the priority communities, if anyone is unsure of the boundaries of these areas or exactly what the eligibility criteria for vaccines are for these communities or any other groups in Manitoba, please visit our website for more information. And we're also putting up a map of the communities on the website as well. So help us to get back to our lives as soon as possible. Please get the vaccine, whatever is available to you, as soon as you are eligible. And with that, we will open up to questions.
Thank you, Dr. Reimer. Thank you, Dr. Atwal. A reminder to reporters, we'll take one question, one follow-up today. We'll start with CJOB and Clay.
Good afternoon. Dr. Atwal, given the variants of concern and the fact that they've nearly doubled from last week, is the province looking, and I'm thinking of schools here, is the province looking at moving students back to home learning?
Sorry, can you just repeat the last couple of words there?
Yeah, considering the increase in the variants of concern, is the province looking for the school system any consideration of moving students back to home learning at this time?
Yeah, it's a great question. Over the weeks, we've obviously seen case numbers rise. You could say on a week-to-week basis for the past 3 weeks, our case numbers have gone up about 40% on a week-to-week, 7-day trailing average. At the same time, we haven't seen hospitalizations increase. The ICU impacts of this are about an 8% per week increase in the ICUs as well. So we're going to continue to monitor the situation. We do see a lot of transmission in younger individuals, including school-age kids. We have had some outbreaks attributed to school activities where protocols weren't followed, but we really don't see school transmission within the school. So a lot of the transmission happens with individuals who are from the same class who, let's say, get together after school, they're having sleepovers or they're getting together on play dates and other factors related to that. So the schools really aren't the issue here. So we're going to continue to look at our case numbers. We're going to look at the impacts on the acute care system, and we're going to take it on a day-to-day basis to see what other things we need to do. I think the message here for everyone is our case numbers are rising. We know what happens with case numbers when they rise. We see what's happened in other provinces in the third wave. We, from a public health perspective, really don't want to limit activities or lock down. There are negative implications of that. There's mental health issues that could surround that. There's other factors at play here, social issues that could happen as well, economic issues which have an impact on health. So on an ongoing basis, we are going to continue to, again, put the least amount of restrictions on Manitobans. We want Manitobans to do what the orders ask them to do, but also follow that spirit of that order. So again, just because you can go do something, maybe you shouldn't. Just because a store is allowed, 333 people in it, maybe the store manager should say, you know what, that's too many people in the store, let's cut it down to 250. Maybe those leaders in these sectors need to do some of these things to help prevent some cases from occurring so we don't have to go into a lockdown. So I think that's the most important message here for Manitobans right now.
Okay, a quick follow-up, and it's regarding the vaccine rollout. We're hearing that some folks in the 40-plus group may be eligible to come in and get their shot, but they're holding back until they can get the Pfizer shot. I don't know if you've heard that, but when will people in that 40-plus group be able to get Pfizer, or are you just recommending they take everything that is available?
Yeah, that's a great question. So we certainly recommend that people go for whatever vaccine they're eligible for now. We've put together the recommendations based on a lot of safety information, effectiveness information, and what we know about the impacts of the virus as well. And so, it's critical for people in their 40s as well to go for whatever vaccine they're eligible for. And I encourage people not to wait until they're eligible for another option, and just get protection as soon as they possibly can. We want to reduce transmission in this third wave as quickly as we can, and so we need to use every dose vaccine that we have available as quickly as possible to get into the arms of Manitobans and reduce their possibility of continuing the spread of the virus. So as far as when people will be eligible, in the very near future, we're focusing on the priority communities, though we have always intended as well to continue dropping the age as we're able to. But for today, the announcement is certainly focused on the priority communities.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Atwal, last Friday you told us that our cases were plateauing and that you're comfortable with where they're at. What has changed in the past week, and were those comments premature?
Yeah, last week's, when I referenced the term comfortable, I was thinking at that moment in time, we were hoping for a plateau. We felt comfortable with those numbers leading into the weekend, seeing where our numbers would go. Obviously, our numbers have increased. We were expecting increases in numbers. The percentage of increase is worrisome. So we are seeing a significant increase in cases from last Friday to this Friday, again on a 7-day rolling average. We've had some numbers higher than 200. We have anecdotal information related to, cases not self-isolating properly. These social gatherings keep coming to the forefront in our contact investigations and case investigations. So all those things mean that there's probably a lot more transmission happening, and we need to be more aware of that. So again, we are going to continue to look at these case numbers. And again, we're asking Manitobans to not only to adhere to the orders, but be a little bit more stringent to it. Everyone always asks public health, what are we allowed to do? What's the maximum that we're allowed to do? And that puts risk out there. And what we need Manitobans to do is just take a step back and say, I understand what the maximum is, but should I go do that, or should I just take a step back? And let's give it a few weeks. Otherwise, we do, have a lockdown at risk. What that looks like when it occurs, it's hard to know. I think we'll have to keep following the numbers, but the longer we can keep our case counts low, the less impact it'll be on our acute care system, which have a tremendous impact on our ability to, again, have some normalcy. Otherwise, we will end up in a lockdown.
Thanks for that. And my follow-up is surrounding some of the stuff that you said there. I mean, you guys at the end of the day are the leaders. You guys are the ones that institute the rules. The rules are in place, and people are potentially following those rules based on the guidelines that are given, except you're now asking people to maybe think about the rules and do something that's less than the rules. I assume that you can understand the confusion that this causes with people, the mixed messaging. So I guess I'm wondering, why aren't you guys doing the leading instead of asking Manitobans to lead?
Yeah, we have orders, we have rules. We're very aware of what those rules are. We've asked Manitobans to follow those rules. We know some Manitobans aren't following the rules. We don't want to, again, put a brake on society. That has a tremendous impact throughout, for everyone, for kids, for adults, for grandparents. It really impacts an economic recovery, which impacts jobs, which impacts mental health, which impacts families as well. So there's a lot of play here. Now, we could very easily, take a broad brushstroke and put in really strict restrictions, but that means shutting a lot of things down. People, I think, at this point really realize the message. You need to limit those interactions. This virus is about interactions. The more we interact with others, the greater number of interactions there are, the greater the risk. The social gathering, that shouldn't have happened, which we see happen in these case and contact investigations, is perpetuating a lot of cases, a lot of contacts, which again creates more risk after one person gets it, another household gets it, and thereafter. So yes, I think our messaging is clear. We are asking Manitobans to limit their interactions. The orders are there as what you can do at most, but think of a speed limit. We have a speed limit. It's 100 kilometers an hour on the highway, let's say. But if it's icy, do we have to change the sign to say go 80? We obviously all slow down a little bit because it's icy out or it's a little bit dangerous out. We could change that sign again, but that's a big, broad brushstroke. We want Manitobans to slow down, limit those interactions. If you like the things that you're doing right now, the ability to go visit a restaurant, the ability to go take your kids to a sporting activity, the ability to shop for non-essential retail, don't put that at risk. Take a step back and let's make sure we don't put those things at risk. Because otherwise, if we keep going down this road, all of those things are at risk.
From Radio Canada, Gavin.
Hi, Dr. Atwal. Looking at maps of active cases in Winnipeg, it seems that, an area like Seven Oaks is hardest hit as far as active cases go, but it's not included in these 3 priority zones. But do you want to just provide maybe and it might be a question for Dr. Reimer, but do you want to just sort of rationalize how you decided which areas would be picked, even though, to me at least, it appears there's more COVID activity in other areas?
I'm going to let Dr. Reimer handle this question here.
Yeah, thanks, Gavin. That's a great question. So we looked at many different things and created an index based on a number of different indicators. The factor that was weighted the most heavily in our index was the number of cases we'd seen in different areas in Wave 2 and Wave 3. So we were looking not just at where right now we saw the virus was present, but also the neighborhoods that have been shown to be the highest risk overall. And so that's why there might be a bit of variation between exactly where the highest numbers are today compared to the neighborhoods that get added to the priority groups. That said, these first 3 communities are truly just the first 3. So next week we intend to announce more priority communities. And so you'll see additional areas being included because they may have newer high case counts. We're trying to identify the communities that see a lot of ongoing transmission and really high risk of having outbreaks in the future. The vaccine takes a few weeks before it works. The body's immune system doesn't respond immediately. It really does take a couple weeks. So our focus is not so much to stop an outbreak that's already happening where everybody in a certain location's already been exposed. Our focus is trying to understand where the highest risk areas of ongoing transmission are, because we want to intervene before we start to see those really focused outbreaks. So it's a mixture of the case counts we've seen in wave 2, the case counts we're seeing right now, and also some of the demographics or characteristics of the people that live in those areas, including the proportion of racialized populations, income, housing, and we're also looking at things like vaccine uptake in different neighborhoods so far.
Thank you for that. And I think this one is for Dr. Atwal this time. Hospitalization and ICU numbers have been creeping up for a while now. How close is Manitoba to starting to slow down non-urgent surgeries once again?
Yeah, so the hospital numbers have been rather stable for the last 4 or 5 weeks time now. The ICU numbers have been trending up. So the ICU numbers, since March 26th on a week-to-week basis are probably going up about 8 to 9%. So at this point, the capacity to continue managing cases is there. So we had a meeting earlier today with representatives of Shared Health. So at the present time, there's a comfort level there. Obviously, there is some concern. There is concern if the numbers continue to go up, the ICU admissions and potentially hospitalizations will go up as well. So we're keeping a real close eye on it. And again, at the present time, it's comfortable, but we are keeping a very close eye on it for sure.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. I gotta tell you, I don't get it. Exponential growth isn't incremental growth. We see on the curve here, we're shooting up really quickly in terms of cases. You're a scientist, so I'm not gonna public health explain public health to you, but we're at 183 7-day average cases today. We're at 123 a week ago. Given the exponential growth that we're seeing, can you provide one specific scientific reason why you shouldn't lock down further right now, today?
Well, lockdowns have negative impacts as well. It impacts lives, it impacts people, it impacts health. Having a lot of cases, having the ICUs full and hospitalizations full, hospitals full of patients as well has impacts on health. So there's two trains of thought here, two thought process where we have to balance that. So we are seeing that upward trend. There's no denying that. Over 3 weeks, the cases have gone up 40% per week. We understand that. We are looking to see what measures can we enact to help limit that risk of case generation in the future. We're having ongoing discussions about that. We had them today. We're going to have them all through the weekend and early next week. We need to kind of see if these case numbers, continue to climb that way, or do we see a little bit of a drop off? And we also at the same time have to monitor our hospitalizations and our ICU use. We've had, roughly 300,000 Manitobans vaccinated already, a lot of them in the higher risk categories based on age. That'll have an impact on the acute care system. So we have to learn about what impact that'll have on our acute care system and take that into account as well. Because again, lockdowns have negative impacts. Keeping everything open and generating a lot of cases has negative impacts as well. So we need to find that balance, and we're reviewing data and information on an ongoing basis to strike that right balance.
Thank you for that. Dr. Reimer, just following up on the decisions to choose the priority areas, will you be releasing, can you release some sort of matrix, a little more detail that shows how those decisions were met? Is it a qualitative balance, or is there like a numerical numbering that makes you and your team go these areas versus these areas? Can you explain that further?
Yes, I don't know specifically what information will be released on the website. I'll have to take that question to our communications team and come back to you. But it is a numerical index. So there is a scoring system that uses census data, local case counts, and a few other sources of information to give a score to the different factors that I mentioned. We weighted the case counts, so looking at wave 2 and wave 3 numbers as the most, as the heaviest portion of the index, but then also included the other ones with a numerical assessment as well. We then had our statistician review the index to see how well it predicted how we had seen transmission happening in the past, to make sure that our prediction was consistent with what we thought would happen based on what has happened. And they felt quite satisfied that it is predictive. Like I said, to get the exact details, I'd have to talk to the communications team, but it is certainly more than a qualitative assessment. There was a numerical assessment provided for each indicator.
From the Canadian Press, Steve.
Oh, hi there. Dr. Atwal, you talked a lot about a lockdown, but short of a lockdown, there are other public health measures that can be taken. Given the rising case numbers and the rising numbers in ICU, have you or your team recommended any additional measures to government at this point? And if not, why not?
Right, so lockdown is always that extreme. I mean, there are other brushstrokes we could take to make the orders more restrictive, and so we are discussing those items. So we're having active discussions on those from a public health side. We haven't made any specific recommendations to government at this point. Again, we have to look at that balance. You know, for every restriction we put in place, there's a negative consequence to that. There's a positive consequence, and that will generate less cases with every restriction, but there's also a negative implication on those that are impacted by that restriction. And that impact could be, again, mental health related, it could be financial related, it could be related to, social well-being. There's a number of different factors here. So again, we are reviewing that information, and I think we'll have more information as time goes on a day-to-day basis. So I think you have to let us go through our process in relation to that and look at that risk and see where this goes from a public health perspective.
And a question for Dr. Reimer. These are 3 neighborhoods or areas that have been deemed high priority. Do you see more areas being named in the short-term future? And if so, would those include areas outside of Winnipeg, such as the north, where we've seen some high case counts in communities?
Absolutely. We plan to release more neighborhoods next week. So the intention was always to create a longer list of communities and then proceed along that list as doses and appointments are available. So that is absolutely the intention, that early next week we'll be able to announce the next group of priority communities. And we're looking at the whole province. So some communities in the future will be Winnipeg, and some will be outside of Winnipeg.
Up next from CTV, Michelle.
Hi, Dr. Reimer. I'll stick with you. I wanted to know, you said last week that you did the validation to make sure that you get it right, which communities go first. Can you explain why these 3 communities were chosen first? What about them makes them the best way to stop spread or mitigate spread?
Yeah, so in these communities, we've seen, starting in October forward, that they've had higher case counts than other parts of the province. So we do know that throughout Wave 2 and Wave 3, there was a lot of transmission in these 3 areas. So that was the number 1 factor that brought them to the top of the list. But on top of that, we also see things like crowded housing being more common in these areas. That makes it really hard to follow public health measures. It's much easier if you have 2 people living in a house to be able to reduce your contacts. But if you have 10 people living in your house, you're always going to have 9 household contacts. So if one person in that household is infected, that's 9 other people who are automatically going to be exposed. So that's another example of some of the factors in these neighborhoods that make transmission really hard to prevent. The other aspects around income and racialized populations, we've seen data both in Manitoba. We saw some good data that came out of Ontario and in the US as well that very clearly demonstrated that people who are lower income experience higher risk of transmission for a variety of reasons. As well, we've seen that our Black, Indigenous, and people of color populations, for a variety of long historical reasons, also experience a lot higher risk of transmission. And these neighborhoods have higher rates of these communities and have higher rates of low-income individuals as well.
Thank you. For Dr. Atwal, I want to ask you, don't you think that Manitobans have some sort of resiliency when it comes to lockdowns? If we did another one now, don't you think people would understand that, you know, these measures would, like you said, save summer?
Yeah, you know, it's like I've alluded to before, lockdowns do have negative effects. I know we've had negative effects come out of previous lockdowns. This pandemic has caused a lot of negative effects to people from a mental health perspective. The further we restrict movement, the further we restrict interactions or the ability to interact has a profound impact on people's mental health, has an impact on kids' development, on education. So again, it is one of those last resort efforts. There are negative implications associated with it. So we want to make sure we strike that balance, that we're doing it only when we have to. I think when we're looking at it from a restrictions perspective, you know, we're going to continue to see what other restrictions we could put in place if we continue to see case numbers rise, increased use of, you know, the acute care system. And again, the lockdown is that last resort. But if we want to prevent that, as Manitobans, we have the ability to prevent that. We have that ability if we all do what's asked and not to the maximal degree of what the orders say. Take a step back, and do that on your own. Businesses should do that. You know, leaders should do that. And nudge your family member to make sure that they're adhering to the order, listening to the order, listening to the message. You know, nudge your neighbor. All those things will have an impact in our ability to generate cases, which will have a profound impact on the restrictions that come into place. So again, it is a tactic of last resort, and it's not something that we really want to do, but if we have to do it, we will, and we're going to try to do what we can to prevent that from happening. But again, it's going to be upon all of us to limit those interactions.
From CHVN, Taylor.
Hi, good afternoon. Dr. Reimer, there's been a lot of public support for teachers to be vaccinated even well before we got the vaccines. Why are they still waiting?
So we have included teachers in the priority community approach. So any teacher who works in any of the communities that we name, starting with the three that I named today, is now eligible to go for a vaccine or book an appointment. You know, what we're seeing broadly, like Dr. Atwal mentioned, is that there's very little transmission happening in schools. So while teachers are working with kids every day, thankfully the measures that the schools have put in place and just the lower likelihood of kids transmitting the infection generally has meant that teachers are not as high risk as healthcare workers, for example. So the teachers are included if they work in areas there's potential for a lot of transmission of the virus, and we plan to continue to have them eligible as we expand those communities.
Thanks. And Dr. Atwal, for lack of a better word, but there's been a lot of finger wagging at Manitobans for these increased cases. But the vast majority of Manitobans are following everything, the public health orders, fundamentals to a T. What, aside from more restrictions, is public health doing to keep these numbers down as we wait for more vaccines?
You know, you're right. Most Manitobans, I've said this before, they're doing what they need to do. There are those who aren't, and that has that ripple effect on others as well. I think a lot of individuals do have that lax moment as well. You know, we can go out in groups of, let's say, 10 outdoors, you know, but do we want to have baseball games occurring with 20 people playing baseball and a bunch of groups of 10 watching that baseball game? As an example, you know, that's a lot of people coming to one event or one game, which poses that risk. That interaction, the playing the game isn't the risk, but it's coming, carpooling together. It's you know, going to watching something, interacting, handshaking, sharing some food, maybe getting together afterwards or getting together beforehand. You know, those technically, you know, a lot of those things aren't against the order, but that does increase transmission risk because of that interaction or interactions in and around that activity. So I think, again, the message here is let's really limit those interactions. Take a step back. The next few weeks is very important to prevent that lockdown from happening. Otherwise, that is sort of the road we're going down with these case numbers going up. So if you want to prevent that, if you want to continue to be able to, have your kids partake in sports, have you go to the gym, be able to go out to a restaurant, be able to go out to a patio, have some social interaction with others, then we really need to take a step back. I think everyone collectively, whatever you're doing, let's all take a step back. Even if we're following everything to a T, just take another step back. Otherwise, we're going to generate more cases and we're going to run into some trouble.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Reimer, my first question is for you. For the sake of transparency, do you believe that the priority index that we've used to select these communities should be made public? And can you please say what work has been undertaken by public health with community serving organizations other than urban Indigenous groups to reach out to those people in those communities and make sure they're taking advantage of this vaccination effort?
So I don't have any concern about Manitobans knowing how we chose communities. We are trying to choose them in the best way that we possibly can to reduce the chance of transmission. So that's why we want to let Manitobans know all of the indicators that we used in our index. So no concerns from me around sharing those factors, which is why I've mentioned them today. We've done a lot of work with a variety of community organizations to reach out to communities in many different ways, and that work is ongoing. So we have partnered with some of the newcomer organizations to help do some presentations with the people that they serve. We've done some work with some of the disability advocacy groups to make sure that they're well informed on how people can access the vaccine and what our approaches are and what they can do to be a resource as well. We are working on things like translating a lot of our materials into many different languages so that they can be both available on the website, but also we can circulate things through some of the local community newsletters that are focused on specific populations. So our communications team, our medical officers of health, our public health nurses, and many others are working very hard to connect with the local communities, because we know that hearing from a local trusted voice is often the most effective way to make someone feel comfortable in going for a vaccine. So it is important to us that we reach out to the community organizations and community leaders to engage them in the process and be that trusted voice for their communities.
Thank you. And my second question is for Dr. Atwal. What reasons, based on epidemiology or otherwise, are behind public health's decision to stick with the current level of restriction and not take even minor measures to clamp down on transmission? You're taking the approach of asking people to change their behavior voluntarily, and you say that more transmission is happening than may be detected. Is it because we're seeing fewer or younger people going into hospital, or they're creating like a larger portion of our active cases, or just what is the rationale?
So, we made some changes earlier this week. We're going to continue to look at what changes need to occur. We don't want to, do knee-jerk reactions to case numbers just to say we have a high case number today, let's do a knee-jerk reaction, create a new order. That's not the intent. Again, these orders have consequences. They have consequences to everyone. So, those things that we look at are case generation, the ages of individuals who are cases, the individuals being hospitalized, the new admissions to hospital, their ages, the new numbers and ages of people coming into ICU, comorbid conditions, had they been vaccinated, had they not. So we're looking at a lot of that information. We're looking at, where that risk is in society, younger populations, where we're seeing a lot of that transmission right now. The risk of hospitalization and acute care impacts is less than an older population, but with the UK variant, it's greater than the wild strain that we had. So again, we're looking at all those things. and really understanding what we can do to try to have, again, some resemblance of a society, a functioning society where people are able to do some things without putting restrictions in place to try to control. We are asking Manitobans, I think public health is asking, we've always been asking to limit those interactions and really only interact if you have to. A broad brushstroke with an order has consequences through many sectors, through many industries. It has impacts on families' lives. It has impacts on mental health again. It is impactful. And we have to be aware of that because there are some negative health consequences that come out of that as well. So again, this is a balance and we're trying to find that right balance. We're trying to use all the information we have to find that balance as well. So we're going to continue to look at it. If these case numbers don't come down, if our hospitalizations creep up or ICUs creep up, the expectation will be if Manitobans are continuing to generate those cases, we'll have to do something to prevent that from happening. And that'll be a progression in restrictions.
Up next, from Global, Brittany.
Good afternoon, Brittany from Global. Dr. Reimer, how much will we have 300 new variants of concern being reported today. So how much is the spread of variants of concern and where we're seeing them, how much will that play a role into what hot zones might come up next?
Yeah, so as I said, we're looking at the case counts going back to October 1st, but what we also did is that the team compared that to the numbers starting on March the 1st as well to ensure that we didn't miss any key geographies that somehow with our index didn't pick up. And any flags that we saw, we reviewed with the local public health team to make sure that there was nothing outstanding that we were missing. And so far, regardless, we've looked at a few different ways to do the measurements, and they've all produced a very similar list of communities. And so we feel quite confident that this list is the best predictor that we have of the future. And we want to try to get vaccines to the places that we think transmission is most likely to occur as quickly as we possibly can.
And in the past, you've talked about working with different sectors to possibly bring a vaccine team into places like a food processing facility to remove that barrier for people that need to get a vaccine. Is that happening, and where would those first ones be?
Yeah, that's a great point because eligibility is really just the first barrier. So even if we had, the vaccine at someone's doorstep, if they're not eligible, they still can't get it. So it was really critical that we ensured that the priority communities were eligible first and foremost. But eligibility is really only the base, and we need to work hard to make sure that many other barriers are removed so that everybody goes for the vaccine. So that's why we're doing things like pop-ups, that's why we're connecting with community groups, and that's why we're connecting with some of the large workplaces as well in Manitoba to explore providing vaccine in the workplace. So we have a team right now who's been doing some of those direct communications with some large workplaces around how we could provide vaccine in their workplaces in the future.
From the Brandon Sun, Kimberly.
Good afternoon. My question is regarding the borders. Manitoba borders are open, allowing Ontarians in, but we can't go there. Why aren't we limiting access to the province from Ontario and other provinces?
It's a great question. So we do have some of the strongest measures. We've had them in place on the provincial border side. So anyone coming into Manitoba, if they don't regularly come in, if they aren't from a border community where they need health services or food, when they come into Manitoba, they are expected to self-isolate. So that's been in place for a while now. That's going to continue to stay in place. So those restrictions are already there.
Thank you. My next question is regarding the community rollout. Will Prairie Mountain Health Region be considered next week for the priority communities, considering the number of cases that are increasing?
So I don't have the final list of communities that I can release today, but I can assure you that there will be non-Winnipeg locations announced next week. And I do expect that most, if not all, of the RHAs will at some point have communities identified as well. But the timing depends a bit on how many people from these different areas call and make an appointment. So we'll have to look next week again to see where we're at and announce communities as we're able to do that.
Our final reporter today from the Steinbach Carillon, Jordan.
Hi, good afternoon. My first question is for Dr. Reimer. What day next month will Steinbach's mass vaccination site open?
Well, I don't have that in front of me, but we certainly, I can take that back and talk to the operations team and get some information to you about when the Steinbach site will be opening.
Okay, thanks. And my second question is for Dr. Atwal. The test positivity rate is up again today. All through the pandemic, public health has provided the TP rate for Winnipeg and for Manitoba, but not for the other 4 health regions. And I think in the past, the rationale was that, especially between waves, not enough tests were necessarily being done outside of Winnipeg to make that statistic meaningful in rural areas. But, I mean, nearly 3,600 lab tests were done yesterday across the province, and you are trying to encourage compliance to avert a third wave. I'm just wondering, will public health start reporting test positivity rates for the other 4 health regions? And if not, why not give that data to rural Manitobans?
Yeah, no, that's something we could take back and look at. I know we looked at it in the past, in the fall. I remember kind of addressing this, I think, where it was, population sizes were small. It might identify certain communities within that region as well. But that's something we could take back and look at again.
All right, thank you. This concludes today's media briefing.